In this video, we'll be discussing the difference between nasal surgery and nasal filler and when people should consider one versus the other. Let's get right into it. Here's a question that I get asked often. Can I get a liquid rhinoplasty to see how a surgical rhinoplasty will look on me? Here's a case presentation that will answer that question. Stay tuned for videos of my patient's treatment. So in this case, this was a 27-year-old woman who was bothered by her nasal hump. She requested filler above that hump. She had no prior history of nasal surgery or nasal trauma. She had no nasal breathing problems. So here you can see her from a frontal view, and she's happy with her frontal view. She likes the way her nose looks when people look at it straight on. She has a narrow bridge, but you can see that light breaks closer to the radix because of the bump that she has, as you'll see in a second. She has a nice well-defined tip with good position and a normal nasal base. Let me draw that out for you guys. The bridge here, as you can see, there is lighting that's coming down here. You can just see how the light bounces off. And then right here, you lose that continuity of light. And that's because of the hump that she has lower down in here that is breaking the appearance of the light above it. And then you can see the light reflects again coming through here into the nasal tip, and the nasal tip has a nice shape to it. It's well positioned. The base of her nose is in a good orientation and position. When I look at the base of the nose, I look on the sides and I see, is the ala lining up with the medial canthus of the eye? And it is very much so in her case. On the profile view, you can see that she has this low radix. The radix is essentially the takeoff point of the nose as it comes off from the forehead down, and where the nose actually takes off is going to be the radix point. Higher above that would be the glabella area. And so in her case, she has a low hump and she has no supratip break. And I'm going to draw that out for you. So right here, let's follow her forehead down. You can see that right there, the nose starts to take off right at this point. So her radix is actually at a very low point. Normally, you want the radix to be at approximately the upper lash line, which in her case would be there. So her radix is starting low, then she has this hump, and there is this connection down all the way to the tip without a break at the supratip. The supratip is this area right in here, cutting through there. So let me just point an arrow to it. Right, that spot. That's the supratip. And because of the fullness of her cartilage, her dorsal cartilage, there is no definition there between the tip and the bridge of the nose. So what are her options? One would be surgery, and that would involve an open septal rhinoplasty, at least in my practice, with hump reduction and osteotomies. That's used to reduce what's called an open roof deformity. So we use bony cuts in order to reposition the roof, because when we take down the hump, it's like you're cutting off the top of the roof, and then the bony cuts reestablish that roof. And also possible spreader grafts. These are little thin types of cartilage grafts that go between the septum and what's called the upper lateral cartilage. They slide in right into that area, and they can help just maintain the dorsal aesthetic lines. The other option for her would be nasal filler, filling above the hump of the nose in order to make it look straighter. So this picture is interesting because this was actually a surgical rendering that I created for her that shows hump reduction, both at the bony and the cartilaginous aspects of the dorsum, which is otherwise called the bridge of the nose. You can notice the supratip definition, and you can see that this is a reductive approach, meaning I took the nose in, which is what we can do with surgery. Filler is just an additive process. Surgery is a reductive process, and we'll be emphasizing that throughout this talk. So what I did was I actually reduced down this whole area here. So that's why this now appears more in. And by doing so, there's been this little supratip definition that was created right here. So the bridge is coming down, and then you have a tip then separately defined. And that's useful. Now, if you look at her radix, where does it look like the nose is taking off? Well, it actually looks like it's now very close to the upper lash line. And that is more of an aesthetic ideal. And the concept here is that most patients, when they're looking for a cosmetic rhinoplasty, want their nose smaller. They don't want the nose bigger. Filler tends to make the nose bigger, so that's something to keep in mind when considering your options. Please make sure to subscribe to this channel if you are not already. And the patient opted actually for filler. So we're going to show you some videos here, and I'll be reacting to them as we watch them through. We use Restylane Lift, which is a high G' filler. This is a type of filler that has weight to it, and it can create some significant volume change, and that's the filler of choice here. This is a BLT cream. This is betacaine, lidocaine, tetracaine, which helps numb up the area before we go in with the filler. The filler generally has numbing inside of it, and that can help with further anesthesia. This is how the Restylane Lift comes. This is when you open up the box. This is what you see here. There's a syringe, 1 cc syringe. I usually will take off the sticker because it actually obscures where the starting point is of the filler. So we do that. And there's this piece here. I had removed it before, that's why it looks a little loose, but here we go. We're opening that up, and then there are needles that come along with it, and sometimes I use cannula. I've talked about that in other videos, but here's a 27 gauge needle. So you remove this kind of little safety device, and this gets screwed on here. So funny story, the Restylane product from Galderma, which is the company, they used to send Restylane Lift with 29 gauge needles, and I remember how difficult it was to push that stuff through that small needle, and I called them up and I said, this is ridiculous. Like, I had one episode where the filler just like kind of came out of the whole syringe because I was pushing so hard, and that's not a good look for anybody. So then I don't think it was just me complaining, other doctors obviously did too. And they were able to change the needle that came now with the packaging. Now it only comes with the 27 gauge. And it's also dangerous to have such a small caliber needle the way they used to do it with a 29 gauge, because you're pushing so hard and you don't know, is it because you're trying to get this thick filler through a small needle, or is it because you're coming up against a blood vessel or some other structure? So that's why you do want a large enough needle for this material to be able to flow through. So this is the pre-filler pan that we did, just so you guys can see the differences pre and post filler. This is a chlorhexidine wipe, so it's a pretty strong wipe. The idea is to keep the area as clean as possible, because when you're putting in filler, it's considered an implant. It's going to be there for a long time. Yeah, I don't know if you know about this, but filler is considered an implant by the FDA, whereas something like Botox is actually a drug product. So they're treated differently, but fillers are considered implants. And you want to make sure that the skin is as clean as it can be prior to any injections. Many people will use just alcohol wipes, and that's usually sufficient as well. I prefer to use something even stronger for my filler procedures. So this is the area right in here that we're gonna fill, this bridge section, to try to get it to be a straighter profile. So I'm just marking out exactly where I kind of want to end and about how high up we're planning on going, which will be most likely to about this point in that region right there. And open your eyes. And the takeoff point should roughly be, in terms of the nose, should roughly be at the upper lash line. Yeah, which is going to be a little bit lower, but this is where we run into these conundrums with filler. It's to make this straighter, you have to fill higher, and that's why we talk sometimes about the option of also doing like a surgical nose, surgical rhinoplasty, where the takeoff point can be a little bit closer to the upper lash line. In order to do this filler injection, we're going to be going higher than that upper lash line. So patients who are definitely not good candidates for nasal filler are those in whom the bump is starting much higher. Even though in my patient here, her bump is lower, there's still a long way to go to filling above that bump to really make the nose look straight. And what I'm trying to explain in this video is that the more we fill up above that bump, the more it starts to look like the takeoff point for the nose is starting way too high, like closer to the glabella area. And that type of look is what some people will call the Roman nose, where it becomes a very, very proud nose. Even though it's straight, it's looking sometimes oversized. With these injections, it's important to be deep in terms of the plane of injection. So the nasal bones are here, and then the cartilage starts a little lower down. The safest location for nasal filler, as far as like placing the filler in, is going to be deep and midline. So when I say on bone or right on the cartilage, that's a safer plane to be in than hovering more superficially or closer to the skin surface. And the more midline you are, the more you're able to generally avoid the blood vessels that run along the nose, especially on the sides of the nose. The division between those two, in her case, is about here, kind of just above that white mark. So we're gonna start working here, right over that initial mark, okay?
Mm-hmm.
So I'm going to the point where I feel bone, placing some filler. Now, some people say that you should draw back on your syringe. There have been plenty of studies on this, and most will say that that doesn't really help. One problem is that the minute you pull back to see that, you might be in a blood vessel, to see if there's some blood that you pull into your syringe or flash of blood, when you start to go to inject again, you've shifted, and even a tiny 0.5 millimeter shift could land you in a blood vessel even if your original pullback showed no blood. So it gives you like a false sense of security, and so it's something that many people who do these types of injections regularly or have a lot of experience with them will not do, because we don't want to be lured into a false sense of security. And the key with these filler injections is to start with small aliquots and to build up, to not just do a huge amount of filler all at one time and then you realize, whoops, maybe I put too much in. So just a little bit at a time. The other thing to remember is that as soon as you start injecting the nose or any part of the face, there's like instant swelling that occurs. So even if you were to not put any filler in, you would still get some swelling. So what's hard is to sometimes know, like how much filler to put in, because you're seeing swelling. You want to compensate a little bit and sometimes over inject by some fraction, because as it settles and the swelling comes down, it's going to look less swollen, less prominent, and that's why it's good to over inject a little bit. And again, with really thin skin, everything kind of shows, and you don't need a ton of product. Yeah, and this is something that plays into surgery as well. The thinner the skin, the more your changes underneath the skin surface become more obvious, but sometimes that can be a problem, because if you have a slight irregularity to the cartilage or the bone, it can really show on the skin surface. If you look at how much we've injected, it's only about 0.1, and you can see there's already visible change. And the point here is that a lot of patients will come in and they've paid for a syringe of filler, and they feel like you need to give them the entire syringe, like put the whole syringe in there because that's what they paid for. But that's not the best way to think about it, because really you're trying to create a cosmetic improvement. That's like the point of these injections. So injecting the whole syringe would only cause for more problems, and not really deliver any type of appreciable improvement. And so that's why we always start with the smallest amount possible, and patients need to be okay with just a portion of the syringe being used, because again, the goal, what they've paid for really, is for a nice result with not a lot of product here. So that's partly because of the thinness of the area, and you kind of mold it and shape it. So you can already see how it's starting to improve the profile, but we need to do a little bit more. It's important to stay in the midline. You don't want to deviate too much to the sides, because there are important blood vessels that live there. Don't look just yet. Let me massage a little bit down here. We're going to add a little more, but I just kind of want to show you what we have. So you can see that massaging, kind of molding it like clay to get it into position. Over time, this filler tends to migrate laterally a little bit as it starts to dissolve. So that's how eventually, and the body starts to metabolize some of it. So that's how, you'd start to lose that effect over time. So the nose is definitely straighter, but there is more size to it, and that's what I was referring to earlier. Now you guys, I think, can see that. So there are trade-offs with nasal filler. And this is us panning now after the filler is complete. And again, it's going to take some time for everything to settle. This is the swollen look. But, this is what nasal filler can achieve. It has limitations. So now we're done with the nasal filler into the bridge. And you can see it's a much kind of cleaner profile. Again, there's a limit to what we can achieve here if we continue to fill. Some people might argue that maybe we should have added some filler to the nasal tip to give her more projection, to make it more consistent with the fuller bridge. But again, that's making the nose overall just bigger, and nasal tip injections have a bit more vascularity and higher risk of adverse events compared to injecting the bridge in the midline. Fill, then it's going to look like the nose is starting from up here at the glabella, which we don't want. So we filled as much as we could fill, created a nice change, and we were talking about this a few minutes ago, but you can actually mold the area further after a couple of days, letting the swelling subside. And then if there's an area where you're trying to kind of just make it a little bit more regular, a little more symmetrical, you can actually mold the filler that was placed with your fingers, and that is okay to do. And this usually sticks around for about a year to 2 years, so it might change a little bit over time, but it does hang around more than filler other locations, because there's not much movement in this location as compared to like the cheeks or the lips. Yeah, that's actually the main reason why the filler will hang around longer in the nose than in other areas, because of the reduced or limited movement of that zone. It's not being broken down by the body as readily as in a place like the lips. Let's move on to various considerations that I think about when it comes to recommending filler or surgery for the nose. So there's the cosmetic versus the functional consideration. Usually for functional problems where people have trouble breathing through their nose, filler is really a poor choice. Usually there's a blockage then of cartilage or bone that we need to surgically address to create more room for someone to breathe, or proper grafting with cartilage to give people, again, that support and structure, and rarely can that be achieved with filler. Now, can a straighter bridge be achieved with filler? Sometimes, as we saw in this situation here with my patient, from a profile view it does appear a bit of a kind of a cleaner, straighter bridge. And then from a frontal perspective, if someone has some deviation, which she did not, you could partially correct that with some filler. What about tip definition? Sure, you can put filler into the tip, but as I said earlier, risk of adverse events go up. Tip irregularities, yeah, you could try to cover that up with filler in part, but again, it's an additive process. So if you have a piece of cartilage that's sticking out, in order to make it look more even with filler, you now have to inject the other side to make that side stick out. But what if all you want to do is just to actually reduce that portion that's sticking out? That's where surgery comes into play. What about the base of the nose? There's very little that can be done with filler to narrow the base of the nose. That's usually a surgical type of technique with wedge resection or sill reduction. What about safety? If a patient has had a prior rhinoplasty, I tend to avoid nasal filler. And the reason is because the scar tissue from the prior surgery has now altered where those blood vessels are. So it could be dangerous to actually inject the nose even in the midline, because the planes are now more fused and scarred down. Also, there are certain danger zones of the nose. And there was a study that was done here. We're going to show this on the screen. In 2021, it was called Non-Surgical Rhinoplasty Using Injectable Fillers, a safety review of 2,488 procedures. And what they found was that in patients who've had a previous surgical rhinoplasty, they had a greater adverse event rate, 10.8%, than those patients who never had surgery in the past. Those patients had an adverse event rate of about 7.4%. Also, they found that injecting the tip and the side wall of the nose had the greatest adverse event rate for both categories of patients. So in my practice, I avoid those areas almost always, the tip and the side wall, for these very reasons. And adverse events can be very serious. They could be the loss of skin from vascular compromise. It could be even something like blindness, which is rare but has happened to people and has been documented in hundreds of cases in our literature. So is filler a good way to try out surgery? Not really. Surgery, as we talked about, is often reductive, while filler is more additive. and the results, as you guys have seen in this presentation, are not the same. So which is safer, filler or nasal surgery? It really depends. Filler is usually relatively safe, but it can cause vascular occlusion, which leads to the things that we just talked about: skin death, blindness, other scary things, and it's higher risk on the nose compared to many other parts of the face or the body. As far as a rhinoplasty goes, also generally very safe, but with anesthesia come serious risks. You have a machine that's breathing for you. Of course, there are risks there. And then there are also, of course, certain cosmetic and functional deformities that are possible after nasal surgery, which could sometimes be difficult to correct in revision procedures. So how long will filler last? Filler will usually last in the nose about 1 to 2 years. It can be even longer, and often the result gradually diminishes as far as the cosmetic changes go, as that filler starts to spread out more laterally. If I had a nasal filler procedure in the past, do I need to get it dissolved before having nasal surgery? And the answer is, it's usually recommended, but it's not necessary. Repeated nasal filler can cause some scar tissue to form internally, and that could make it more difficult when operating on the nose. Since you enjoyed this video, check out our video about rhinoplasty, where I take a model of a head and I put in different types of grafts and show you guys the actual surgical steps that we take to make people's noses look and feel and breathe better.